I'm Anjanette Levy, and this is Simply Medicine, the show designed to make medicine simpler, less costly, and better for you. We have to talk about you and prostate health and how to know when your prostate might be getting too big. One of the things we want to do here on Simply Medicine is talk about topics that are a little bit uncomfortable. We've already talked about prostate cancer, but this week we are going to discuss an enlarged prostate and what that means. So I want men and women to both listen to this and don't feel uncomfortable. We all have these issues. But joining me to talk about this is Dr. Ryan Flynn. He is a urologist with the Urology group in Norwood. Dr. Flynn, thanks so much for joining us and welcome to Simply Medicine.
Thanks for having me, Anjanette.
What is an enlarged prostate, also known as BPH?
So an enlarged prostate is something that happens to guys as we get older. As you said before, it's very common, and the majority of guys over 50 will start to have some problems with it. And it will often cause urinary symptoms, difficulty urinating, pushing, straining, going to the bathroom more urgently and frequently. And it's a different entity than prostate cancer, like you mentioned as well.
What does BPH stand for?
Benign prostatic hyperplasia, which all it means is it's benign, not cancer, and overgrowth of the prostate tissue.
Do we know why that overgrowth occurs? Is it from a hormonal change, or is it just the prostate, like everything else, gets old because we age?
Yeah, similar. Both of those things are probably accurate. And there is some genetic component to it, but some hormonal changes that happen usually when you hit about 50 lead to overgrowth of the prostate tissue that can become obstructive.
Where is the prostate? Just so listeners who might not realize where it is. I mean, it's in that whole area, that whole urinary area.
Yeah, great question. So it's actually has at the outlet point of the bladder, and it's circumferentially around the urethra, which is why when it grows, it actually blocks off that outlet point from the bladder. It produces some of the fluid that's in your semen, and so that's its purpose. But once we get older, pretty much all it does is cause trouble.
How big is the prostate?
Normal prostate's about the size of a walnut.
So when BPH occurs, the main symptom is trouble urinating?
Yeah, and there's two main sides to that. The first side is the difficulty urinating, so the pushing, straining, intermittency, stopping and starting of the stream. And then there's the effects on the bladder in terms of as the bladder has to work harder, it has more urgency and frequency because it doesn't stretch as much. And that can also manifest in getting up at night because your bladder just isn't willing to hold on to as much urine.
I'm Anjanette Levy, and this is Simply Medicine on 55 KRC, the talk station. We are here with Dr. Ryan Flynn of the Urology group in Norwood, talking about BPH, which is also an enlarged prostate. What happens if you're a guy and you have all of these issues? and I don't, maybe men don't, maybe they just think, oh, I'm just getting old and this happens or whatever. Maybe they don't know what's going on. First of all, what can you do to treat it?
So yeah, I hear that all the time that, oh, I figured this is just because I'm getting older. And so guys will a little bit talk about it often with each other, or they'll notice that their buddies are going to the bathroom more because it is very common, but there are a lot of different ways to treat it. Sometimes it doesn't need any treatment. Usually the first step is there's medications that can help. And then if the medications aren't doing the trick, there are minimally invasive procedures or bigger surgeries that can be done to open up that channel.
What are some of those minimally invasive procedures? I've heard of one. I've actually had very long conversations with somebody I know about this one thing you guys do. So
the most common one, the new phase one that we've been using more and more is this UroLift, which has been a really great new procedure within the last 10 years or so. That's a good medication alternative. It's not as invasive as some of the other old school procedures that are still great in the right patient. The TERP, or the Roto-Rooter as guys commonly call it. But the UroLift is one that, like I said, is less invasive, where you go back and just pin back the sides of the prostate rather than having to go in there and scrape everything out.
Oh, scrape. That sounds awful. Oh my God. Okay.
Sometimes those words get to guys. There's more involved with it, but it's a good way to remove tissue. And again, it's a matter of figuring out which is the right procedure for the right patient.
Sure, of course. And I'm certainly not trying to laugh about that. But whenever you hear about scraping, it's just, women have that too, going to the gynecologist and stuff like that. What happens if you don't treat your BPH? Does that put you at risk for prostate cancer, or what can happen?
Doesn't cause any risk of prostate cancer. It can cause some worsening of symptoms. Typically, once it getting started, those symptoms aren't going to revert. And so a lot of the time in the beginning, it's just a quality of life issue. But as it gets worse, it can put more and more strain on your bladder. And so we're putting more focus on bladder preservation and treating earlier in your symptoms to avoid the really detrimental effects of long-standing issues. It can be at some point you can't pee at all and you have to have a catheter in or intermittently catheterize, because there can be permanent damage that occurs if we don't get it treated in time.
And if you have permanent damage, would you have to remove the prostate?
Oftentimes we'll still try and remove part of the prostate or open up the channel somehow. But again, if there's permanent damage to the bladder, sometimes even opening up that channel won't help the urinary symptoms. And so it's a matter of figuring things out. But again, oftentimes that's catheters and becomes much more cumbersome than just getting in and getting something fixed sooner.
Sure. So like anything else, treat it earlier and it's much easier on your body and on your wallet, your insurance, everything.
Absolutely. Yeah, there's lots of different ways to go about this. And I think a lot of guys do delay because they think it's normal, or they don't want to talk about it, as you mentioned before, because it has to do with that down there. But it's something that's nothing to be embarrassed about. We hear about it all day, every day. So, and so does your primary care doc. It's nothing to be ashamed of talking about, because it is very common, and there are things we can do to make it better.
Dr. Ryan Flynn with the Urology Group in Norwood, thank you so much for joining us today on Simply Medicine.
I appreciate you having me. Thank you.